going to be a how to play with your baby, how to entertain your baby, different activity ideas for your 9 to 12-month-old baby. I hope you enjoy it.
Language practice, and to do this I use learning word baskets. I get some objects of the same type and I put them in a basket. In this example we're doing animals, but you could do vehicles, colors, nature objects, the list goes on, but it just helps them with their vocabulary. So you can just say, shark, bear, etc. It'll help them with their cognitive skills, their sensory, their reach and grasp, and so many things.
Doggy.
Up next is a shape sorter. Now, this specific one has a little too many for the 9 to 12 month age, I think. So as they're starting out, tape over some of the opening and give them less pieces. That way it's a little easier for them to start with, and then you can gradually untape and give them more pieces as they get better at it. But this is going to help with hand-eye coordination, fine motor. It's going to help them with problem solving and cognitive development. You can tell them the shape, you can tell them the color. There's many ways to learn as well as have a hands-on games with this.
The content presented in this video is not meant to replace the advice of your pediatrician and should not be used to inform treatment. The following is meant only to provide recommendations for newborn care. Please consult a pediatrician for medical treatment related to you and your newborn.
I don't know how to put this on. It's on backward. He doesn't have any feet. I don't know how to put that on. You're nice and clean now.
There are a wide variety of diapers available. Most disposable diapers have tabs on the back and an indicator strip on the front that changes from yellow to blue when the diaper gets wet. To fasten the diaper, place the tabs from back to front and pull the two tabs gently to the front of the diaper. It should fit snugly, but not too tight. We often fold the diaper under the umbilical cord so that it does not irritate your baby's skin. If you do decide to use baby wipes after discharge from the hospital, just like for soap, try to avoid anything with perfume. While it may smell really pretty, it can be a sign of irritating chemicals. There's no need to use any diaper cream for routine diaper changes. If your baby develops a diaper rash, you can use a white zinc oxide cream that creates a barrier over the skin so that urine and poop will not irritate the skin.
Hi, I'm going to change your diaper, you okay? So first things first, we're going to take off the icky one.
Remember to talk to your baby throughout all daytime diaper changes and use all that face-to-face time to help stimulate your baby's brain and language development.
For babies who have been circumcised, we recommend that you keep the tip of the penis well lubricated with petroleum jelly so that the healing skin does not get stuck to the diaper. You can apply this directly to the tip of the penis or to a piece of gauze and place that over the penis. Do this with each diaper change for 1 week. For uncircumcised penises, do not force the foreskin back. It will naturally separate when the child is older.
It is normal for female genitalia to be slightly enlarged and red after birth. There may also be white discharge or even a little blood from the vaginal area. All of these are related to hormones from the mother and should resolve with time. When you're doing a diaper change, you do not need to try and remove all of the white discharge from the vaginal area. But when your baby has pooped, you should gently spread apart the folds and clean out any poop from front to back.
This is how you rock a baby to sleep. He's sleeping. Oh. He's about to wake up. Uh-oh.
Thinking about safe sleep and healthy sleep habits is an important part of your role as a parent. Let's begin with safety and what you can do to reduce the risk of sudden infant death syndrome, also known as SIDS.
The highest risk of SIDS is between 4 weeks and 4 months, but there is risk for the entire first year. We do not know exactly what causes SIDS, but there have been many studies looking at what decreases the risk of SIDS.
The recommendations include placing babies on their backs to sleep, having babies sleep in their own space like a crib or a bassinet with a firm mattress and fitted sheets, and having no loose blankets, pillows, stuffed animals, or sleep positioners in the crib.
Please note that car seats, swings, bouncers, and strollers are not safe sleep places and should not be a substitute for cribs or bassinets. Ideally, babies should sleep in the same room, but not the same bed as a parent.
Having a smoke-free environment, using a pacifier, and avoiding overheating have also been shown to decrease the rate of SIDS.
In addition to safe sleep, we want to talk about developing healthy sleep habits. In the first few weeks of life, your baby will not usually have long stretches of sleep. But some babies are sleepier, and I want to remind you to wake your baby every 3 hours to feed until your baby regains birth weight. Usually this happens the first 2 to 3 weeks of life. At night, you may be able to stretch out feeds once your baby is gaining well. Newborns may not be able to tell the difference between day and night and may actually be more awake at night than during the day. To help, during the daytime, try to make feedings and diaper changes more stimulating by talking and making eye contact and giving your baby lots of exposure to light. Your baby's longest stretch of sleep should be at night, so wake your baby if their daytime nap is lasting more than 3 hours. At nighttime, everything should be quieter with dimmer lights, less talking, and less eye contact. Feedings are brief and boring, and diaper changes are less engaging. Now, some people may think that if they keep the baby up all day, their baby will be really tired and sleepy at night, but that doesn't work. A tired baby is much more likely to be a fussy baby and have difficulty calming their body down and going to sleep. Give your baby an opportunity to sleep every 1.5 to 2 hours after being awake. Your goal should be to work towards putting your baby down to sleep awake, but in a drowsy state. As your baby gets older, try not to have the baby fall fully asleep on you, or while feeding, or while in motion. If your baby is in a drowsy sort of dreamlike state, but still awake, they can begin to put themselves to sleep on their own. Then, if the baby stirs and wakes themselves up, as many babies will do just by startling themselves with a snort, they can think, oh, this is where I fell asleep, and will be more likely to be able to calm themselves down to go back to sleep in that space without needing you. You may hear about sleep training. Around or after 4 months of life, some parents will decide to sleep train. But here we're talking about good sleep habits and want to emphasize that your baby is too young to be ignored when they're crying at night. Babies at this young age need your help to calm their bodies down because their brains aren't ready to calm themselves down just yet. This doesn't mean you have to go to them with every sound. Sometimes they're just fussing a little. But if you notice that they're about to really cry, you're better off soothing them before they get themselves too worked up. Even though your baby may be waking up many times throughout the night, it's helpful to establish a bedtime between 6 and 8 p.m. A bedtime routine may include bath, breast, bottle, maybe some rocking or singing, really whatever works for you. Doing the same thing before bed each night, even when your baby isn't sleeping for more than a few hours at a time, will help signal to them that it's bedtime, and they will grow to love and look forward to that time together.
Okay, Bella. It's okay, lovey. In the wind blows, the cradle will drop. That looking glass break, Mama's gonna buy you a...
Crying is one of the ways babies communicate to us their wants, whether they're hungry or wet, uncomfortable, too hot, too cold, tired, sick, or just unhappy. Sometimes your baby has been fed, changed, is not hot or sick, is in your arms, and is still crying. Keep in mind that if your baby has a witching hour and gets fussy around 5:30 or so, this may just mean it's bedtime.
Between 3 to 8 weeks of life, many babies become more fussy, with peak fussiness around 6 weeks. All babies need help calming their bodies during this time. However, some babies cry more than others and are more difficult to soothe. We refer to this as colic if a healthy, well-fed infant cries for more than 3 hours per day, more than 3 days a week, for more than 3 weeks in a row. Typically, colic begins around 3 weeks of life, and the crying is more common in the evening hours. The way a baby seems to move and cry often gives the appearance of stomach discomfort, but no exact cause of colic has been identified. If your physician thinks your baby has colic, you can discuss ways to help soothe your baby safely, as this can be a frustrating and challenging experience for many parents.
This is how you swaddle. Let's tighten up. Now his head's sticking out.
Here are a few things that often help calm a baby. Let's start with swaddling.
Let's quickly review how to swaddle. If you are using a regular blanket or a swaddle from the hospital, start by laying it out flat. Fold down the top corner and center the baby's body with the shoulders right along the top. Then, take one corner and pull it across over the shoulder and tuck it down behind the back, keeping the arm down. Pull the bottom corner and tuck that also behind the shoulder. Finally, take the last corner and pull that around the baby and tuck it behind the back. Be sure to keep the blanket loose around the legs, but snug around the chest.
Swaddling should be used for infants under 2 months of age. Many babies are also soothed by sucking on a pacifier, your finger, or their own hands. Pacifiers are fine to use for soothing and sleep once breastfeeding has been well established. Never tie pacifiers to the crib or around your child's neck or hand. At 6 months of age, you may want to limit pacifier use to the crib so that it doesn't interfere with your baby's attempt to babble and communicate. Many babies will also settle down when they hear white noise. This can come from you saying, shh, close to their ear, a white noise machine, an app on your phone, or a household sound like a vacuum. Many babies like a little bit of movement such as standing up, bouncing, gentle rocking, swaying, or a light swinging motion. You're going to become an expert soother of your baby, but it isn't easy. If you feel overwhelmed, upset, or angry, it's okay to put a crying baby in a safe place like a crib and give yourself a break for a few minutes. Call a friend or a family member, pour a cup of tea, and then come back. You can always also call your baby's doctor and let them know that you're overwhelmed. They can help you with other strategies to help soothe your baby. We want to be clear that it is essential that you never shake your baby, as forcefully shaking a baby
We're
can
going to be
cause...
focusing on milestones for your 9-month-old and activities that you can do with your 9-month-old to help them achieve those milestones.
Next, we're going to jump into some cognitive milestones. This is any milestone that has to do with how your child thinks or how they perceive their world. The first milestone we're going to be working toward is playing Peekaboo. We're really working toward a skill called object permanence, and that is the idea that when your child loses sight of something, that it continues to exist. It's really interesting, but babies, actually, if you cover up a toy with a blanket, to them, that toy doesn't exist anymore. We're trying to build this idea that it still does exist by playing Peekaboo with your child.
Where's Dada? A Peekaboo! Where's Dada? Peekaboo! Where's Ainsley? Oh, peek! A Peekaboo! Peekaboo! Wow! Where's Ainsley? Oh, Peekaboo! Peekaboo! A peek! A peek!
The next cognitive milestone that we're going to be working toward is also related to object permanence, and that is that when your child drops a toy, they may look for it. So, we're going to be sitting in a high chair, we're going to play with some toys, we're going to drop it, and we're going to encourage your child to look for that toy.
Look, here's one too. Where'd it go? The toy fell down. That's right, good job. Look, it's a toy. Where did it go? Did it fall down? Yeah, it fell down. It's on the floor.
Now we are going to move on to social and emotional goals, which are goals related to the way that your baby understands her own emotions as well as social interactions with others. The first milestone that we are going to look at is a more advanced sense of imitation, which is not just restricted to sounds and words, but expands into facial expressions and gestures as well. We are going to practice this by playing with baby in the mirror, making silly faces or hand gestures. Let your baby observe what you're doing and see if they will mimic you as well. Hi. Hi. You say, ah, yeah, 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 yeah. Oh, you got it. High five. Yeah. Yay. Yay. Hi. Give baby kiss. Mwah.